Good morning, good afternoon, and good evening to all of our Head Start viewers. My name is Nurse Yolanda, and I am the health manager here at Elkhart and St. Joseph County's Head Start Consortium. I'd like to take the time to welcome each of you to the consortium where we make a difference. One of our goals is strengthening our families through education, empowerment, and knowledge. So as we begin the 2020-2021 school year, I would like to welcome all of you to the Elkhart and St. Joseph County's Head Start Consortium. For some, this is a new experience, and for others, it is a return to a positive and rewarding relationship. Our goal with you is one of partnership. That partnership is based on mutual respect and trust, and geared towards assisting you in meeting the needs of your child and strengthening the family. Elkhart and St. Joseph County's Head Start Consortium program. It is a quality program designed to help your child become kindergarten ready and help him or her on the road to a lifetime of learning. Your child is our future, and we will do all we can to ensure that the children in our program receive the highest quality of services. Your involvement in the consortium's program will enable us to continue to realize the possibilities of how we can best serve the children and families of Elkhart and St. Joseph counties. Having said that, please allow me the time to introduce the health team to you. The picture that you are viewing right now is one of our members of the health team. His name is Dionel Jimenez. He is a certified medical assistant, and he can be reached by cell phone 574-276-3379. And again, his name is Dionel Jimenez. He is a certified medical assistant of the health team. Next, you are viewing a picture of another one of our health team members. Her name is Shaniqua Love Harris. She is a certified medical assistant as well, and she can be reached on cell phone 574-274-5135. Again, that is Shaniqua Love Harris, and she is a certified medical assistant here at Head Start and can be reached at the following phone number. And then there's yours truly. Again, my name is Yolanda Washington, and I am the health manager here at Head Start. My cell phone number is 574-849-1859. We can also be reached through the office, which is a general office number of 574-393-5864. So we are here to meet the medical needs of your child and to help assist you in making sure that you have the proper documentation for your child to attend school. So, what are some Head Start health requirements? If you do not have a family doctor or dentist that was assigned to you by Medicaid, and you need one, you can call your family and community specialist who will help you. The consortium emphasizes the importance of early identification of health problems. The goal of the health services is to improve and maintain the health of your child and his or her family. Prior to the start of school, arrange for your child to receive a physical and dental exam by your family doctor or dentist. All exams must be completed and submitted by the child's home visit and prior to school entry. So please allow me to reiterate a little bit on the physical, immunizations, and dental. We know that this year has started out in an unusual and an unordinary way. So what we are doing is that if your child is receiving service via center-based, in other words, your child is actually coming to the school to be serviced, your child requires a current physical, immunizations before they can actually start. However, we know that doctors' offices have been backed up and they are running behind on getting these children's well child exams done. So if you have documentation proving that you have an appointment for your child to attend, your child is welcome to attend at that time. So either way, we need some form of paper stating either your child's physical has already been completed or your child has a physical that is coming up. So we need that documentation so that they can start school, because our goal, again, we want to keep all of our children healthy and safe. And so we want to make sure that we have the proper documentation prior to the start of school. And those numbers that I gave you a few slides above, please feel free to call us anytime so that we can further assist you should the need arise. Now, if you are a Medicaid recipient, Medicaid will pay for your child to have a physical and or his or her immunizations. If your family is covered by other insurances, either medical or dental, please use that. If you do not have Medicaid or insurance, then you can apply for Hoosier Healthwise. Your child should have his or her physical and dental exam completed before entering the classroom. The consortium's forms, which the doctor and dentist sign at the time of the exam, must be returned to the consortium's family and community specialist. Remember, all exams must be current and up to date and completed prior to school entrance. And again, these forms will also be located on our website, so you can go to the website to download the physical exam or the dental exam. And then, of course, you can just always ask for a current list of your child's immunizations. All children enrolled in the consortium will need to have their routine physical or well child exams completed at the following ages and prior to entry: at 2 months, at 4 months, at 6 months, at 9 months, at 12 months, at 15 months, at 18 months, at 24 months, at 36 months, and then yearly. Your child's dental exam will need to be completed between the ages of 18 to 24 months of age and every 6 months or more frequently as recommended by the dentist for follow-up. We also recommend that your child sees a dentist at the first sign of the tooth. So when the child's first tooth erupts or that tooth comes through, that's also a good time to actually see the dentist so that they can make sure that the teeth are growing the way that they need to grow and that they're growing correctly. The consortium requires that all children are up to date with state and federal immunization guidelines to attend Head Start. A copy of immunization records are required at time of application. Due to federally mandated standards, every child is required to be tested for lead and hemoglobin between the ages of 9 to 12 months, 24 months, and between the ages of 3 to 5 years old if not previously tested. Your doctor may perform these tests at the time of a well child exam. If they have not been completed by your doctor, a Head Start nurse will complete the lead and hemoglobin by age requirements deadline. So in the event that your child does not have these screenings for the lead and or hemoglobin, the Head Start nurse will complete those screenings, but we must have a signed consent from the parent and or guardian giving us permission to do the screening. In the event that you think that your child is ill or suspect a possible communicable disease, please do not send your child to school, okay? These signs and symptoms include, but are not limited to, a fever of 100.4 degrees or higher, an unusual rash, vomiting, diarrhea, loose stools 2 to 3 times per hour, a cough and or unusual behavior, or they're just not acting like themselves. Additionally, COVID symptoms would include a cough, runny nose, sore throat, and diarrhea. If your child has a diagnosed health concern, asthma, seizure disorder, or food allergy, a healthcare plan must be completed with a Head Start nurse prior to the start of school. If medication is prescribed for the diagnosed health concern, a parent permission to administer form must be completed prior to your child attending school. The parent permission form must be signed by the parent or guardian and prescribing physician. The medication can only be accepted in its original box from the pharmacy. The box must contain the pharmacy label, including the child's name and instructions. In the event you don't have access to a printer to download and print our parent permission form, the doctor can always type up something from their office and print it on their letterhead and sign it, and you can use that form as the permission form from the doctor's office. Okay, so it does not necessarily have to be on our form. Again, if you have any questions about any of this information, please don't hesitate to reach out to me. To help us maintain the health and safety of your child, please ensure the following requirements are completed before the first day of school. The health care plan with the Head Start nurse. The parent permission form signed by the parent or the guardian and the physician. And then the medication must be received by the Head Start nurse in its original container or box. If medication is required for school, an individual med bag may be required for emergency medications. Individual med bags must be transported daily to and from school and handed off from adult to adult. So let me give you an example of this. If your child is on an albuterol inhaler for the sake of asthma, that inhaler, along with its original box, would go inside of a red med bag provided by the Head Start staff. The necessary paperwork would also be inside of that red bag. That red bag will go to and from school daily. The medication will be given from the parent to the bus driver or directly into the hands of the staff, depending upon whether the child is transported via bus or not. Then on the way home, the medication goes from the staff to the bus driver and then back to the parent. At no time will the child be allowed to hand deliver the medication to an adult. The medication would never be stored in the child's backpack to go to and from school on a daily basis. Okay, and of course, if there's questions, you can always contact us and we will clarify it for you. So when is sick too sick for school? We are actually going to skip this slide and deal with it a little bit later down the line when we come to our COVID information, because things have since changed. So let's talk about COVID-19 or coronavirus. At the end of 2019, a new type of coronavirus began making people sick with flu-like symptoms. The illness is called coronavirus disease 19, or COVID-19 for short. The virus spreads easily and has now affected people in many countries. So how does coronavirus spread, or COVID-19? Well, people can actually catch coronavirus from others who have the virus. This happens when an infected person sneezes or coughs, sending tiny droplets into the air. And these droplets can land in the nose, the mouth, or eyes of someone nearby. The individual can also breathe in that virus. People can also get infected if they touch an infected droplet on a surface and then touch their own nose, mouth, or eyes. An example of this would be if an individual coughs or sneezes and does not cover his or her mouth, and those droplets will actually land on the desk. Someone else could come by and touch the desk and then touch their own nose, mouth, or eyes, and then they can actually catch the virus and actually spread it to someone else. And experts are also suggesting that the virus can also be spread through stool or poop. So call your doctor and keep your child home if your child or someone in your family has a fever, cough, belly pain, vomiting, diarrhea, rash, dizziness, a runny nose, or just not feeling well. In the event the child becomes sick while in school with the above symptoms, he or she will be sent home and will be required to submit documentation from their doctor in order to return to school. Additionally, tell the doctor if they have been near someone with COVID-19 or lived in or traveled to an area where lots of people have the coronavirus. Also, Keep your child home in the event someone in your household has tested positive for COVID-19 or been exposed to a family member who has tested positive. So, what are some signs and symptoms of coronavirus? Again, COVID-19 causes a fever, cough, difficulty breathing. Some people might even have a sore throat, chills, repeated shaking with chills, muscle pain, headache, a loss of taste or smell, COVID toes or feet, which is like a pinkish color on your toes and your feet. They can have abdominal pain, stomach pain, and the virus can become more serious in some people. So here's a question that some of you may have. What do I do if my child requires asthma medication at school? Well, if your child requires medication at school for asthma, the child will be required to use an inhaler that has been recommended from the CDC, which is the Center of Disease Control, instead of using nebulizers. So if your child requires medication at school, please contact a member of our healthcare team for further assistance. Also, you want to make sure that your children or your child is up to date on their vaccinations. Again, we want to help protect them and to keep them safe, and we also want to protect them from the measles and other flus. So kids who have another infection may have a harder time getting better if they get COVID-19. So we talked about how coronavirus is spread and what coronavirus is. So now, how is coronavirus treated? Well, currently there is no cure, and most people with COVID-19, including children, do not have serious problems. They usually get better with rest and fluids. But it is important to keep kids with COVID-19 away from others who may have a harder time with the virus. In the event that you or someone in your family comes in contact or tests positive for COVID-19, please keep your child home and inform the Head Start staff. So, how can I protect myself from COVID or coronavirus? Here's just some tips to help you protect yourself and your family. Keep your family home and away from others as much as possible. Avoid other people, especially those who are sick, and busy places until the outbreak is under control. Remember, COVID-19 can spread before a person has symptoms and even when someone has no symptoms. If you need to go out, remember to wear your cloth face mask on adults and children 2 years of age and older to help decrease the spread of the virus. Remember, do not use a face mask meant for a healthcare worker because they're needed in the hospitals and doctors' offices. And also, there's another resource that I have listed, again through the CDC, on how to put on and correctly take off your mask. Also remember to stay at least 6 feet from others whenever possible. Wash your hands well and often. Wash your hands for at least 20 seconds with soap and water, or you can use hand sanitizer in the event that you don't have access to soap and water. The hand sanitizer should contain at least 60% alcohol base. And then teach your kids to do the same, and always supervise them when using hand sanitizer. Try not to touch your eyes, your nose, and your mouth as much as possible. And then, of course, you can use a household cleaner to wipe down and to disinfect surfaces while at home. Always follow the recommendations of your health department, the CDC, and always follow the directions of the label of the chemical that you are utilizing. Experts around the world, they are studying and tracking COVID-19, and they're learning on a daily basis on how to keep it from spreading. So I've listed some resources here again: the Center for Disease Control and Prevention, the World Health Organization, your state and local health departments. They all have websites and they keep up-to-date and reliable information, so you can always refer to them when you have questions. So, how is Elkhart and St. Joseph County's Head Start protecting children and families? Well, guess what? We are doing the exact same thing that has been recommended by the CDC and our local and state health departments. So, in order to prevent the spread of the virus, we do regular deep cleaning of the offices, the classrooms, the toys, the furniture, the light switches, the doorknobs, and high-touch objects. We limit the number of people in our waiting area. For example, we might have people wait in their cars until it's time for pickup and dismissal. We screen everyone who enters the building by asking about symptoms and taking their temperature. All the staff members are required to wear masks, and children over the age of 2 years of age as well. All staff and students are required to stay home if they feel ill or if they have any symptoms of COVID-19 or if they have a temperature. So, again, I want to take this time to welcome you to Elkhart and St. Joseph County Head Start Consortium. If you need anything from me, again, you have my number. My name is Nurse Yolanda, and I will be here to assist you in whatever healthcare needs you may have. I hope you and your child have an awesome year here at Head Start. And again, welcome to Head Start.